Sorry. Okay. So this is a paper 4 question that I have selected. So this came not in May, June, but this is a question which came, I think, in 2018 or something like that. So I've just modified it to the current type of questions that will come. So let's discuss this. So look at the question. The question is, design an experiment to investigate the effectiveness of biochemical treatments for people suffering from OCD. So biochemical treatments, what do you think they are talking about? So there are some important words in the question. The first important word in this question is biochemical treatment, right? And the second thing that they are asking you to do is that you have to design an experiment, right? So I'm just highlighting the important points here. So you need to know what an experiment is, how to design an experiment, what are the important features of the experiment, they have to be listed, and what is the topic? The topic is OCD, obsessive compulsive disorder, and the effectiveness of biochemical treatments. So what do you think biochemical treatments are? Biochemical treatments would be medication, right? And what type of medication should be given to people who have OCD? Basically, the important thing to note here is that you need to learn the content, which basically means everything about the topic, you need to learn it. Otherwise, you will not be able to do the question well. Now, this question in your paper 4 is worth 24 marks, right? So, why? And so, therefore, the 10 marks are for design part, which we are going to discuss, and the other 14 marks are based on whatever you have designed. Now, to design the experiment, basically, or design any research method, what you need to do is that you need to let me just open your syllabus on page number 52. Like, this is very important. That's why I am opening it in front of you, so that you know when you're studying, how are you supposed to study. So when you open page number 52 of your syllabus, they have already given you a guideline of how to plan your studies for paper 4, right? And when you are designing your study for paper 4, there are certain things which definitely need to be there. The first thing that definitely needs to be there is general features. So general features basically means these are the features which apply to all the methods, whether you are doing an experiment, whether you are making a self-report questionnaire, whether you are making a correlational study or a longitudinal study. These are the features that will be present in all the methods. So all the methods will have, when you're designing a study, you should include an aim and hypothesis, procedure, sample, sampling technique, ethics, validity points, reliability. How are you going to make the study reliable? What type of data are you going to collect? Is it going to be a quantitative or qualitative type of data, or both? And then how are you going to analyze the data to see whether the aim or the hypothesis that you have outlined, whether it's supported or not, right? So general features have to be there in all the research methods. And the second thing that's important is the specific features. So specific features basically means that these are the features that are specific to each research method, right? They should be described in sufficient detail. As they have written, it should be in sufficient detail for replication. That basically means that if somebody wants to do the experiment or do the interview or the correlation study, they should be able to replicate your design. So it should make sense. It should be doable, right? So if you look at the question that we are discussing right now, there you have to make an experiment, right? So when we are talking about experiments, these are the specific features that definitely, or most of these features have to be present in the answer with the terminology when you're writing the answer. So for example, if you're making an experiment, you have to tell whether it's a field experiment or a lab experiment. So that has to be identified. The location has to be identified. The type of experiment that it is, lab or field. Of course, the terminology of experiments will be independent variable, dependent variable, controls over extraneous variables so that they don't become confounding variables, like situational variables if they can be controlled, or participant variables if they can be controlled, or experimenter or investigator variables if they can be controlled. They have to be mentioned. And then standardization. A lot of good ways to standardize the experiment needs to be mentioned so that it can be replicated. And then, of course, experimental design has to be mentioned, whether it's repeated measures design or independent measures design, depending on the type of question and what makes sense. And if you're using certain type of experimental design, whether you'll be using random allocation or counterbalancing, right? So let's look at the question. Going back to the question is design an experiment to investigate the effectiveness of biochemical treatments for people suffering from OCD. Your plan must include details about the experimental design and the sampling technique, right? So let's start and let's see this answer that I have selected for you. And let's see at the end how many marks this answer will get if you were the examiner or if the examiner was checking it. So in order to investigate the effectiveness of biomedical treatments of OCD, I would conduct a field experiment using randomized control trial. What do you think is a randomized control trial? This is a psychological terminology, but what do you think it means? So if you are using words, this is a tip. If you're using any psychological terminology, you have to clarify by explaining what does it mean. So randomized control trial basically means the participants would be randomly allocated to either the treatment condition, where people will be given selective serotonin reuptake inhibitors, SSRIs, or they'll be in the control group where the participants will be taking a placebo. So when you are writing that I'm going to do a field experiment, so this is a terminology where you have specified, or the person has specified, what type of experiment will it be. But right now it's not clear how it's going to be a field experiment, but randomized control trial has been explained that there'll be random allocation where participants will be divided into two groups, the experimental group and the control group. And this experimental group will have SSRIs, and the control group, the participants will be given a placebo, right? So directional hypothesis of this study will be, now what do you think is a directional hypothesis? Let's write it together. The directional hypothesis, if I'm saying that, I want to write a directional hypothesis or a non-directional hypothesis, or any type of hypothesis, what is the important thing that needs to be there? So both the independent and dependent variable and both the groups and the direction needs to be mentioned. So how do you think we'll make a directional hypothesis for the study? So let's see, try and write it. So let's say if we say SSRI will show a greater reduction, or will show a greater, or greater ki bajaye will say will show a reduction in symptoms of OCD in patients as compared to the placebo. right? So SSRIs will show a greater reduction in symptoms of OCD in patients uh, in the I think maybe we can improve on this a little bit also. Um, let's write patients taking or patients in the experimental group taking SSRIs will show a reduction in symptoms of OCD as compared to patients in the placebo group, right? So this makes better sense. Now, when you're writing any directional hypothesis or a non-directional hypothesis, the experimental condition where the independent variable is present needs to be mentioned. The control condition needs to be mentioned, and the independent variable definitely, and the direction has to be mentioned as well. Okay, let's read further. SSRI medication will be effective in symptom reduction for people with OCD as compared to placebo. Maybe this is also a directional hypothesis. So let's move forward. Now let's look at the sample. A sample of 20 males and female patients. So we are going to be talking about the sample here. So I'm just out highlighting the important points. So the examiner is also going to highlight the important points, when marking. So sample of 20 male and female patients in the age range of 18 to 60 years, newly diagnosed using ICD-11 criteria for OCD will be included in the study. These patients will be recruited using voluntary sampling. Okay. Psychologists and psychiatrists from 2 mental health clinics in the 2 local kar lete hain. Let's write local here. Local mental health clinics in the city will be contacted via email by the researcher and asked to help with the research study. They will be requested to distribute leaflets to newly diagnosed patients, informing them about the study, about OCD, and asking for volunteers for free biological drug treatment. Right? So this is the incentive. Um, so maybe this that they'll participate because they'll be getting free treatment. The leaflets will state that the study will require their commitment for 6 months, and it would be made clear to the participants before the start of the study that they may receive the actual drug or the placebo, right? So therefore, what is this we are talking about? Ethical guidelines and informed consent is being addressed here. From the participants who respond willingly, from the patients who respond willingly to participate in the research, 20 people will be selected with 10 males and 10 females, and will first be asked to sign a written informed consent. So ethical issues यहाँ पे address हो रहे हैं. We have already talked about sample, and also we have seen that the candidate has discussed volunteer sampling technique and how they're going to recruit the participants. The psychiatrist will be requested to only inform about this research to the people who have recently been diagnosed. So this is all repetition. But let's see what they've written. Newly diagnosed patients with OCD and have not yet begun with any treatment for their disorder. Okay, why? So this will remove any previous experience of therapy as a confounding variable. So this is a control over some extraneous variables, like if they already had been taking any treatment, then that might make them improve or reduce the symptoms of OCD rather than the medication. So it's important that they previously also, and they're recently diagnosed, and they should not have started any type of therapy or treatment yet, right? Um, So all the participants will start from the same baseline level, increasing the internal validity of the research results. Okay, so this is something that is being done to increase the validity of the research. It would be made sure that the male and female patients are not taking any other medication that could interfere with SSRIs, which will be given in this study, and that female participants are not pregnant or nursing a baby, as medication can have side effects. So all of these are controls. And what does the control help you achieve? Validity. If there are good controls over confounding or extraneous variables, so what are they trying to, what type of variables are they trying to control this candidate when they're saying male and female patients are not taking any medication? This is participant variable, and they are at the same level, and they are not taking any medication that can interfere with SSRIs. They are all at the same level. They all have been recently diagnosed with OCD. They have not yet started any treatment. And female participants are also not nursing a baby or pregnant, because medication can have side effects. So it's ethical also, and also control. Participants will continue to conduct their lives as normally, and will be assessed as outpatients. So this basically means that if they're continuing to conduct their lives as normally and will be assessed as outpatients, means that they'll go home and come regularly to visit their doctors for the next 6 months, and they'll take the medication at the convenience of their homes. They will not be admitted in the hospital. So it's going to be actually a natural environment where they are a part of this experiment, and therefore it's going to be a field experiment. The study will be conducted over 6 weeks. It's 4 weeks taking the medication and 2 weeks without the medication. Okay. In addition to this, patients will be followed up with 6 months, within 6 months after participating in the study. At the start of the study, and then each week during the study, the participants will be given a questionnaire to assess the severity of their obsessions and compulsions, and their ability to participate in everyday activities, and their general health, to investigate the frequency of side effects being experienced. Because when you are giving medication to people, sometimes the medication can have side effects. If a medication doesn't suit anyone, then people might not adhere to the advice, or might not take the medication. So the next section here, now you could either write that the participants would be assessed using psychometric questionnaires like Maudsley Obsessive Compulsive Inventory, or Yale-Brown Obsessive Compulsive Scale, YBOX. Or you can make your own interview or questionnaire trying to assess the symptom severity. Ideally, the candidate should have written, they would assess the participant's symptom severity every week using one of the psychometric tests, which can either be Yale-Brown Obsessive Compulsive Scale, or it could be Maudsley Obsessive Compulsive Inventory. But this candidate has made their own assessment questions. So each question will be scored on a scale of 1 to 10, 1 being no impulse or obsession. So I'll just put no obsession, right? No symptoms or not affecting this activity, and 10 being very strong obsession or compulsion. It could also be a compulsion. Severe symptoms greatly affects this activity. Sorry. Okay. It will be a double-blind placebo-controlled trial or study. What do you think double-blind placebo-controlled study means? Double-blind basically means that the participant also doesn't know whether they're getting the actual medication or whether they're getting a placebo. And the person who's giving them this, they also don't know which condition the patient is in. Are they getting the real medication or are they getting the placebo? Because the main experimenter or investigator is not dealing with the patients himself or herself. They are just overlooking the whole procedure, and so that their own subjectivity or information or knowledge does not become a confounding variable. Because if the main investigator or principal investigator uh, is involved directly with the patients, then they would definitely know that I have given this patient SSRI and this other patient a placebo. And so therefore, this knowledge might affect how I see the symptom reduction. And I might expect the people who are getting medication should show symptom reduction. So then my subjectivity would become a confounding variable. To remove that and to have control over investigator variables, they use what is called a double-blind placebo-controlled trial, where the investigator doesn't know and also the patients don't know. So the patients are also blind to whether they are getting the actual medication or are they getting a placebo. So that has to be explained. So where neither the participant nor the primary researchers interacting with the participants are aware of which condition a particular participant has been allocated to, a double-blind technique will be used in the study, meaning the parts. So this is a repetition. I'll just remove this. So only the principal investigator will have this knowledge. This is done to remove demand characteristics and experimenter effects in the study. So this will also lead to, so we can write this is done to improve or increase, kar lete hain. Increase validity by removing or removing the chance of demand characteristics and experimenter effects in the study. Okay, I will use an independent groups design and randomly allocate participants to either the treatment group or the control group. Okay. All the pills, real as well as placebo, given to participants will be of the same shape, size, and color, and in similar prescription bottles. What is this? This is also a standardization, because the color of the pills or the bottles, then if people find out, they would know, that we are in a different group. So to remove that issue, therefore they have used these this control also. The participants will be given questionnaires when they come to collect their prescription for the next week. So every week they'll be assessed and given questionnaires. The procedure will be that participants will be assessed about the severity of their OCD using the questionnaire. The participants will be divided into two groups of 10 participants each, with equal number of males and females, and both groups will have participants with equal number of participants. I don't think that this is relevant. Okay. For 4 months, the experimental group, where the independent variable is present, will be given standardized dose of SSRIs, and the control group will be given the placebo. The medication will be prescribed and monitored by the doctor. Participants will be seen individually, with participants in different conditions seen on different separate days. Participants will be informed. Now, I think if you are writing this, you need to add, why are you doing it? What is the need for it, right? Participants will be, and we'll add that here. Participants will be informed in the information leaflet that they would be allocated either to the treatment condition or the control group, and they can withdraw at any time from the study. And they'll be debriefed about their condition after 6-month follow-up, and consent will be sought to include their data in the results. If the participants experience significant side effects or their symptoms become too severe, then they will be withdrawn from the study. In this case, alternative therapeutic techniques will be offered to the participants free of charge, right? The results from the initial questionnaires will be used as participants' baseline data. An average of the scores for straight statements on each category, which means severity of symptoms, ability to participate in everyday activities, and general health, will be taken. Each of the scores for these categories will be taken from the baseline score, a score to assess whether improvements are being made or not in the end of 6 weeks. I don't think it was 6 weeks. Therapy, medication, medical therapy, right? Or biological therapy, biochemical therapy. Dependent variable will be operationalized with at least a 35% reduction in scores on the questionnaire after and long-term effectiveness of SSRIs will be assessed as at least a continued 35% or more decrease in questionnaire score at 6-month follow-up after treatment. So the basic thing is that, let's see, go back to the question and let's see if we have a good answer here. So it had to be an experiment to investigate the effectiveness of biochemical treatment for people suffering from OCD. Basically, let's look at, and then the other thing was that experimental design and sampling technique had to be mentioned, which were mentioned actually. But let's see if these things have been mentioned. So type of experiment was mentioned, which was field experiment. Independent variable was not clearly mentioned, but yes, the experimental group where SSRI would be present is the independent variable, but it should be mentioned using psychological terminology. Dependent variable was the reduction in questionnaire scores from baseline to the end. The control over extraneous variables, yes. Standardization of the procedure was also there. Experimental design was also mentioned, that it's going to be independent measures design. Random allocation was mentioned, and location was not clearly mentioned, but it was said that, they'll be living their normal lives. So we assume that it's a field experiment. And then if you look at general features, so the aims were mentioned, hypothesis was mentioned, procedure is mentioned well, sample and sampling technique is mentioned, ethics also has been mentioned, validity and reliability, yes, has been addressed. Type of data. This I think, did they, yeah, I think they did mention the type of data specifically, I think is not. Let's check. Okay. 35% reduction in scores. So most, a better way would have been that the dependent variable will be the scores on the questionnaire, and it would be the success of SSRIs would be operationalized with at least a 35% reduction in score. So that needs to be added here, like quantitative data will be collected through the questionnaires. So that is not mentioned very clearly. But if you look at the question, and it does actually is a good answer. And if you look at the overall marking scheme, so I'm just opening that also for you, how the examiner is going to mark it. So just to give you an example, the examiner is going to look at the marking scheme with a checklist with all the features which are present or not, and it's going to be a level-based marking. So level-based marking basically means that there's the level is from 0 till 5. 5 is the highest. 0 means that you have not written anything, or whatever you have written is just not required. The response, if the appropriate method has been used, if it describes specific features with accurate detail and general features also with accurate detail, and it also shows good understanding and the plan is coherent, it makes sense, it is sufficient to replicate, which this plan was, and psychological terminology and methodology has been seen in the answer. It shows good understanding of ethical guidelines. Yes, it does. So this is going to be a level 5 response. If the examiner is very strict, they'll just give it a 9 out of 10. If they are if like, for example, 9 out of 10 because like quantitative data, for example, specifically has not been mentioned, if the controls have been mentioned but not specifically identified as controls, the word independent variable is missing, so it would be at a 9 out of 10. But if the examiner gives the benefit of the doubt, then they can also give a 10. But these are the things that need to be mentioned. The psychological terminology needs to be specifically mentioned when you are answering a question like this. Okay, now let's look at some other questions of this. Like, for one piece of psychological knowledge on which your plan is based, describe this psychological knowledge, right? Now, this question basically means that which research study or theory gave you the idea to design the study that you have designed in your part A. So when you talk about the psychological knowledge, you have to mention either an example study or a theory which has used, in this case, for example, the biochemical treatment, which is SSRI. So which which study comes to your mind? For example, if you're talking about this, which research study can you identify or remember? So here again, the question is learning, whether your learning is good. If you have had good knowledge, you immediately answer it. So the answer here would be, I'm just trying to open your book. So if you, for example, sorry about it. So I'm just opening the book for you. So I just want you to know that, you need to learn the content really well, right? So if we go to page number 221, right? Let's see. So if you go to the treatment part, so if you go to the treatment part, sorry, I just doodled a little here. Okay. So there are psychological therapies and then there are biological therapies. So when you talk about biological or biochemical therapies, there is this evidence of SSRIs. And so you will write this in the psychological knowledge that OCD can be treated with different drugs, antidepressant and anti-anxiety. The most used medication is SSRI. What does it do? That needs to be mentioned, like here. What do? They block. So these medications work by blocking the serotonin from being reabsorbed once a message has been passed from one neuron to another, meaning that serotonin levels remain higher. And then the evidence of that is this study by Sumro. In a meta-analysis, Sumro 2008 reviewed the results of 17 studies where 3,097 participants, which compared the effectiveness of SSRIs with placebos. The study used Vibox to measure OCD symptoms. In all studies, SSRIs as a group were more effective than placebos at reducing OCD symptoms 6 to 13 weeks after treatment. So 6 to 13 weeks. Okay. The effect of taking SSRI to treat OCD is that they reduce the severity of OCD symptoms, they lessen anxiety, they have been shown to work in individuals with or without depression. This is something that even if you don't write, it's fine. Higher dosage of medication is given to treat OCD than it is used to treat depression. It has been shown to be more effective. So there's no need to write this part, but definitely the study of Sumro and details of that should be written here, right? So that would be the 4-mark summary that would come in here. The second part would be explain how you use 2 features of this psychological knowledge to plan your experiment. Now, the important thing is that you need to use 2 features of maybe Sumro's study. So, and you need to write which features did you use and why. So, for example, if you read this, or and you say that, in the meta-analysis, Sumro reviewed the results of 17 studies which compared the effectiveness of SSRIs with placebo. Therefore, in the study that I have planned, I have also compared the effectiveness of SSRIs with placebo. And the second feature could be that this Sumro used Vibox to measure OCD symptoms. And ideally, if you also used Vibox, if the candidate had written that they used Vibox to measure the OCD symptoms, then you would say the same psychometric questionnaire is used in the planned study as well. So you have to identify how you have used 2 features of the psychological knowledge to plan your experiment, right? So these would be the maybe 2 of the features. Yeah, if for example in Sumro study they did the study, some studies were between 6 weeks or 6 weeks, between 6 and 13 weeks. So you have also chosen 3 months, or so 3 months, so 4 weeks in a month. So 3 months would be 12 weeks, right? So 3 months, you say if the studies was 3 months, then you have also used the same time period. So things like that, right? How you used any 2 features of this psychological knowledge to plan your experiment, right? Then the C part is G.
अगर हम like
Yes.
psychological knowledge में is it important कि हम हमेशा किसी study का ही reference है, या can it also just be like a theory or something? Like जरूरी है कि हम सिर्फ किसी example study या जो
So
separate studies लिखी होती हैं वो उसके बारे में लिखें?
Ideally, तो कुछ भी आप लिख सकते हैं. So for example, if a question is about the symptoms only or diagnosis, so maybe you can write about ICD-11. So that would be a diagnostic criteria. Maybe there's no study to back it up. That's also fine. Depends on the type of question that you're doing. But if you're doing clinical psychology, there would definitely be some example study to support the point, because they will always ask you 2 features of that knowledge. So if it's a theory, then which 2 ideas of the theory have you used? You can also write those. But because it's a clinical psychology question, so most of the clinical psychology content, they have backed all of the theories or ideas with some example studies. So एक तो होनी चाहिए आपके mind में, ठीक है? Then 2 reasons for your choice of experimental design. So which experimental design was used in this study? And when you are writing a question like this, so for example, if you are asked, which experimental design did you use? And so you say that the experimental design used is independent measures design, then you have to give a reason why and how, explain it, right? So for example, if you say independent measures design is used, um, uh, 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 the reason being that there were two groups. Um, one was the experimental group where SSRIs would be given, and the other one is the control group where placebo would be given. And the reason for independent measures design or independent groups design is that the same participants could not be given both the placebo as well as the SSRI. So repeated measures design would not be possible, number one. The second reason that you can give is if they've asked for two reasons. The second reason that you can give is that one of the reasons why I have used independent measures design is that in independent measures design, the participants will do only one condition of the independent variable, and therefore they would not try to guess what the experiment is about and respond to demand characteristics. And so therefore, independent measures design is most suitable, because otherwise it's not practical. And secondly, if repeated measures design was used, and if you, for example, used these all these patients had been given placebo in the first week, or maybe placebo for the first month, and then for the next 3 months you had given them SSRIs, it would not basically make any sense, right? So that can be the reason. So maybe one reason, I think generally they'll ask you either one or two reasons. Um, and that's why I'm saying that it's very important that your knowledge of your research methods, strengths and weaknesses of all of these things, the sampling technique, the experimental design, all of these things are very, very important. Explain one strength of your choice of experimental design. Again, many times what happens is that students confuse. So when you are writing part C1, always remember to compare in this. So when you are writing about a reason, reason means that you would say independent measures design is used because of this reason, and this would not have been possible or practical if the other design was used, for example, repeated measures design, because it would have this problem, right? So compare two things similar like designs, and say why you have chosen this design over the other, right? The second question is just explain one strength of your choice of experimental design. So for example, if you've used independent measures design, why do you what is one strength of using an independent measures design? So basically when we are talking about the strengths of independent measures design, you could write that um, they could also ask you for a weakness. So for example, अगर उन्होंने weakness पूछी होती, तो it would be something like independent measures design requires more participants, and it would be difficult to find or match the participants, as there will be individual differences among people even suffering from OCD. Some would have mild symptoms of OCD, or some would have severe symptoms of OCD. So therefore, that can be a problem. But strength of the experimental design, I think you have to look through your book and see which other strength you want to write. Sampling technique, if you're saying volunteer sampling technique, why are you using volunteer sampling technique? Give one reason for it. So again, whenever you have to write a reason, I would suggest compare. So if you say volunteer sampling technique is used because participants will be more willing to participate for the next 4 months or 6 months, jitni bhi aapne, या 3 months, whichever time period you have identified. And because they're participating with their own free will, they will not drop out of the study or not exercise their right to withdraw, as compared to if maybe opportunity sampling technique was used, so things like that. Give a reason why your choice of sampling technique, that one that you have used, is better than the other. Because opportunity sampling would mean people who are already present or are being diagnosed on the spot when you are there in the clinic, and you ask them, do you want to participate in the study? Maybe they'll say no, right? So that would be opportunity sampling technique. So why volunteer sampling technique is better than opportunity sampling technique? You give a reason for that, right? So this is how you need to answer the questions. Wait. So any questions about what we have discussed so far?
नहीं,
Aisha and Hareem. So I would like you to look at the past paper questions. मेरे ख्याल से, let me see, कौन सा क्वेश्चन आप देख सकते हैं इसका. मैं आपको देती हूँ एक क्वेश्चन, दिखाती हूँ, एक सेकंड कोई ढूंढती हूँ. और इसको भी मैं थोड़ा सा बेहतर करके ना आपके ग्रुप पे शेयर कर दूंगी शाम को, इस वाले क्वेश्चन को भी. लेट मी सी फरवरी मार्च में कौन सा आया. तो ये जैसे क्वेश्चन आया था ना, इम्पल्स कंट्रोल डिसऑर्डर का आया हुआ है, तो मे बी यू कैन चेंज इट. So you can get a question, plan a covert observation या खाली observation to investigate the effectiveness of a therapy. कोई भी और थेरेपी आ सकती है, जैसे ऑब्सेसिव कंपल्सिव डिसऑर्डर की थेरेपी है एक्सपोजर एंड रिस्पॉन्स प्रिवेंशन थेरेपी, whether that is effective for treating people with obsessive compulsive disorder. And आगे जो भी points हैं वो same रह सकते हैं. So you can change it from ICD to OCD, and instead of covert sensitization, you can add the point of exposure and response prevention, and you can design an observation. ठीक है? So you can practice these questions, and अगर कोई questions बाद में हुए तो फिर आप मुझसे पूछ लो, ठीक है?
Okay, thank you so much.
Okay, that is.
Allah Hafiz.